Hey everyone, this is Dr. Jaime with True Health Chiropractic, and we're starting a new video series to educate specifically on the spine and its direct correlation to the nervous system. We're kicking this week off with our vertebra of the week, C1, also called the Atlas. Your C1 vertebra is located directly below the skull, and in fact, that's why it's called and referred to as the Atlas. In Greek mythology, Atlas was a titan that literally held the world on the top of his shoulders. The Atlas, or the C1 vertebra, literally holds your head on top of the spine. The C1 vertebra is considered the most important vertebra in the spinal column because it protects the brainstem. Neurologically, the brainstem controls all the subconscious functions in the body, like breathing, vision, hormones, reproduction, and many other things. So many times people will ask what symptoms could be associated with a C1 vertebra being misaligned. Oftentimes when people have things like dizziness, vertigo, TMJ or jaw pain, headaches, high blood pressure, ear infections, depression, ADD, sinus problems, and even colic in babies, there's usually a misalignment of the Atlas. Body parts that can also be affected due to an Atlas being misaligned could be your face, ears, eyes, jaw, head, and the entire neck itself. So how do we know if the C1 vertebra is misaligned? The primary method is a specific set of X-rays in which we analyze and measure the Atlas to look at the exact angle it's positioned in the spine. However, the C1 vertebra tends to be the most dominant misaligned joint due to the birth process, and this includes natural births, C-sections, and even vacuum deliveries. We do not X-ray newborn infants, so an assessment of the C1 vertebra in a baby could be to check range of motion of the joint, feeling for swelling and edema, and muscle and tissue hypertonicity or hypotonicity. Those are fancy words for checking to see if a muscle is too tight or too soft. So if you or someone you know are having some of the symptoms I mentioned earlier, the first step is getting checked by a corrective or a wellness chiropractor. Or if you're a patient underneath chiropractic care, this could actually be a warning sign that you need a chiropractic adjustment. Stay tuned for more tips, tools, and strategies on how to stay healthy and well.